morning, everyone. Good morning and welcome. We are thrilled to have so many people here. If you would like, you are welcome to come forward sort of into the hallways if you can't see from where you are. And there's also an overflow room back this way with monitors, so if that would be more comfortable for you, you're welcome to do that as well. We're thrilled to have so many people here with us today celebrating. My name is Lynette Marshall. I have the privilege of serving the University of Iowa Center for Advancement, and we are so pleased to have so many folks with us this morning. We are delighted to celebrate this important milestone for University of Iowa Healthcare, for our community, for our patients, and for our families. Today, we mark the dedication of a new destination for healthcare for the University of Iowa. We have a gorgeous new cutting-edge facility and top-level providers who will soon bring it to life and contribute to healthier futures for all of us across the state of Iowa and everyone who comes to Iowa for their healthcare. We will contribute to healthier futures for all. We have lots of special guests who are here today to help us celebrate. We will recognize all of them collectively after I introduce them, so please hold your applause until the end. We're pleased to have Congresswoman Mariannette Miller-Meeks with us, as well as Rochelle Fuller, representing the office of Senator Charles Grassley. From the Board of Regents, we're pleased to have several friends here. President Sherry Bates, Regent David Barker, Regent Robert Kramer, Regent Christine Hensley, Regent Jim Lindemeyer, Regent J.C. Reiswick, Regent Greta Rouse, and former President Mike Richards. From the Regent staff, we're pleased to have Mark Braun, the Executive Director, and many local officials who have been elected. Senator Art Stade, Senator Janice Weiner, the Honorable Megan Foster, Mayor of Coralville, the Honorable Louise Fromm, Mayor of University Heights, the Honorable Chris Hoffman, Mayor of North Liberty, the Honorable Tim Kasparek, Mayor of Tiffin, the Honorable Tiffany O'Donnell, Mayor of Cedar Rapids, the Honorable Bruce Teague, Mayor of Iowa City, Lisa Green Douglas from the Johnson County Board of Supervisors, Mandy Remington from the Johnson County Supervisors, and many community leaders. Thank you all for celebrating with us today. We, of course, also have lots of people from the University of Iowa who have helped make this happen. University of Iowa President Barbara Wilson, Dr. Denise Jameson, Vice President for Medical Affairs, and the Tyrone D. Arzt, Dean of the Carver College of Medicine, Brad Hawes, CEO of the Clinical Enterprise for University of Iowa Healthcare, and Larry Marsh, the Department Executive Officer and Chair of the Department of Orthopedics and Rehabilitation and holder of the Carol B. Larson Chair. We also have donors who are with us today who have helped make this facility possible. We are grateful for your dedication to this facility and to an endeavor that will benefit generations to come of patients and their families. This facility, as you know, is the new home for the Department of Orthopedics and Rehabilitation, allowing our providers to provide a full range of care in one location for a seamless patient experience with windows. Here to tell you more about that and about what our community can expect from this new space is the Chair and Department Executive Officer, Dr. Larry Marsh.
Thank you, Lynette, and thank you for the acknowledgement of the windows. What many of you don't know out there is that we are coming from the main campus, and we are in the basement there, so we do not have windows. Some of you know that. So along with this crowd, this day, this facility, all these cameras, it is windows, and so that is something really, really good. I am representing the Department of Orthopedics and Rehabilitation, but I'm also, I think, the only speaker that is actually going to live and work here. So I am representing literally hundreds that in 2 weeks, we will be shutting the lights off, and on Monday, we will turn the lights on here. And it is just remarkable that that will really happen. I think it'll really happen. We're planning on it happening. So anyway, it is my honor and privilege to be here on behalf of the department, my faculty colleagues, the residents and students who will be our future learners here. Thank everyone for their support that made this happen. And I won't try and do names at this stage, but so many people that made this happen. And we are so grateful, and it has been a really long journey. I will spare you all of the details. We are really excited about this campus. I hope everybody here in this standing room only shares at least a little bit of our excitement. On April 28th, this will certainly be the newest musculoskeletal hospital in the country. But I can tell you it will also be one of, if not 2 or 3, largest in the country. There aren't many other facilities that like this, and I think all of us should agree, this is subjective, it'll be the most beautiful and the most remarkable. So that's what it'll be for sure. Patient care. As the population ages and as technology has advanced, the expansion for orthopedic care has been really remarkable, and I have seen it during all of my career. The population of Iowa and elsewhere wants to keep moving, they want to stay active, and to the extent possible, they want to be pain-free. And that's what orthopedics is all about. I'm a recipient of orthopedic care. I bet you many in the audience are. Again, as the years get up and you want to be able to stand at podiums, walk around places like this, orthopedic care is what it's about. We have always been the center in the state that takes care of the most complex problems, the most challenging patients, the referrals of complications from elsewhere, and we will continue to do that. That is what we do. But this facility, this parking, these clinics, that physical therapy down there at the end, walk-in injury clinics, all of these things allow us to expand our care to a wider range of population that is really challenging when you're in the basement of a tertiary care center and with the parking and the challenges, and it's challenging for patients, not just us. This premier orthopedic center will offer a one-stop coordinated care for orthopedic patients. We will have on this campus all of our subspecialized faculty and other clinicians, state-of-the-art physical therapy that you can see down there at the end, an amazing imaging center, and 12, maybe soon to go, 16 operating rooms and all the perioperative services that go with that. To move away from patient care, those of you that were here earlier this morning, the Education Center is on the 2nd floor, remarkable new education center. We will also be expanding our research. Our biomechanics lab will be here, innovation for future generations for education and research to help things be even better for Iowans. Those things are all here at this center. And these are aspects of this hospital that set us apart from other community hospitals and even other specialized hospitals, that the whole thing is here. Last point I really want to make, I have been speaking on behalf of our department, but there are really 2 things that are moving here. It is our department and it is the hospital. And we will all be one here in a way that it is difficult back on the main campus because there are multiple departments. And just by way of cementing that, I want to thank from the hospital side, Amy Birkland, from the department side, Amy Birkland and Mary Grieve. They're both here. You can wave just a little bit to the group. And from the hospital side, Amy O'Dean and Brian Gardner, who are here in the front row. And we have truly been all one in planning it and we will move in being all one, and the hospital and the department really is the same. So with this new world-class facility, our department and this hospital will build on its heritage of excellence in patient care, education, and research, and will continue to serve the people of the state of Iowa and beyond. Thank you all for joining us on this spectacular day today, and it's now my pleasure to hand it over to Brad Hawes, the CEO of our institution.
Thank you, Larry. What an exciting day, and the turnout here is incredible. So thank you all for coming and joining us. I kind of processed this event a little bit in a personal way because of my journey, which hasn't been nearly as long as many of the people involved here. But I was here a few years ago as the CFO of the enterprise, and I don't know if I lost my mind and went to Georgia for a couple years. And then Dr. Jameson posted a job as the CEO here, and I raised my hand and said, pick me, and lucky enough to be able to come back. In that journey, when I was here before, was when we had the certificate of need application that failed, and then a second one that was approved. And then when I left before construction started, I was so excited when I came back, even for my first interview, driving down from the airport. And I pulled off here to say, I wonder what that looks like. And oh my gosh, it's a beautiful facility, and I'm so excited. And now it's even more beautiful, and the opening is really incredible. So Larry said that they came from the basement. We call that the lower level. So it sounds a little bit better. But I do remember taking tours, and often we would have trash cans gathering rain and other things that were leaking and occasional floods there. Despite that, we still have more people that want to occupy the space that Dr. Marsh and his department are vacating. One of the things that's important about this facility is not only is it wonderful, and I won't amplify on the things that Dr. Marsh did, but I will kind of put it in context. We still, as UI Healthcare, can't take all of the transfer requests that we get from the state. So this expansion of capacity, together with the downtown campus, really allow us to treat more patients that are being referred to us so that we can provide the excellent and world-class care that we do across our domains. And so that capacity creation is really an important part of what we do. And so Larry, his vision, we at one point had talked about a facility like this at the Iowa River Landing. We felt like we needed something more expansive, and so we're thrilled to be here. I mentioned earlier this morning that I think we all ought to take congratulations at UI Healthcare because we used to have a sign on the corner for over a decade that said coming soon. I think some city officials said you need to take that down or deliver on your promise, and so I'm thrilled to say we can be here today and deliver on that promise. A few people that I want to thank specifically, and I won't do names, but our capital management and facilities team in healthcare has been amazing to get this done. They've had a lot of partnership from the university facilities and design team. That partnership is really instrumental in a lot that we do. J.E. Dunn, our general contractor, the design team was led by Newman Munson Architects. And then we've had an operational consultant here to get us ready. We've not done something like this off-campus, new facility, and the readiness for this opening on April 28th is something we're really keyed into. We've run many dry runs. We learn every time that we do it. Need to think about that, need to think about the other, and yellow brick has been really helpful. We're excited about the comprehensive nature of this facility, an emergency room, a pharmacy, super advanced imaging, are just things that I think the community will utilize and will be successful in addition to the excellent surgical and inpatient orthopedic care that we create. And so the other thing that we're proud of here, and Dr. Marsh mentioned it, sometimes it's complicated on our university campus because we have so many things going on, and when we want to optimize or innovate, it's complicated. We view this as an ideal place where we can innovate and actually challenge and develop orthopedic care into an even more renowned service that we provide. And this will provide us really a learning laboratory from which we can do that. And it's one of the things that we're most excited about, that we can maybe take some of those lessons and then interject those lessons back on the university and the downtown campus as we go forward. So it's a wonderful thing here. Couldn't be more excited. So I'll close my remarks and now welcome my boss, who thanks for taking me back, Dr. Denise Jameson, who's the Vice President for Medical Affairs and the Dean of the Carver College of Medicine.
Thanks for being here. Wow, what a great crowd. It's really exciting to see so many of you. Really wonderful to look out and see so many friends and supporters and people who care about the community. This project is an investment in our community. So I'd like to thank all of you who supported this project in some way, shape, or form through resources, service, advocacy. And we're also grateful for the support of the Iowa Board of Regents and state officials. So thank you. This campus now serves as a symbol of trust that UI Healthcare will remain committed to our mission. And our mission is to serve 3.2 million Iowans across 99 counties. Every year, we see millions of patients at our campuses and clinics across the state. We conduct research that advances care for Iowans, and we train nearly half of all Iowa doctors. And this campus is an extension of that mission. It'll help us see more patients in a care experience that is specialized, and as you walk around, you'll see how patient-centered it is, and it's enhanced by our other missions of research and education. This facility offers a new level of comprehensive orthopedic care that has not previously been available in the state. And I'm going to say that again because I think it's the most important thing that we can say today. This facility offers a new level of comprehensive orthopedic care that has not previously been available in the state. We're really excited and we're really proud. This North Liberty campus will be a game changer for the doctors who work here, for our faculty, for our staff who work here, for learners, but most importantly, for our patients and for our community. We are really eager to share what we've built for Iowans and how it'll increase access to patient care services while also advancing medical research and education. So thank you for joining us in this historic moment. We're really excited and we thank you. I'll now hand it over to my boss, the University of Iowa President, Dr. Barbara Wilson.
Good morning, everyone. Wow, it's so wonderful to see all of you here today. Thank you for celebrating with us. This is truly a momentous occasion, and when I thought about what to wear this morning, I thought, I'm going to manifest spring with this jacket, okay? And several of you have commented on it, and now I'm thinking, why did I wear black and gold? And Representative Miller-Meeks actually did wear her black and gold. Where is she? And she pointed out, there she's right in front, and she pointed out to me, you're not wearing your colors today. So there's a reason I'm not wearing our colors. I'm manifesting spring, and if you look out there, you see the trees are budding, the grass is green, and it's a beautiful day to celebrate. I want to thank all of our donors for their generosity. We heard from at least one of them this morning who kind of got teary-eyed talking about the impact of this facility and the medical care that we provide and the research that we do on his life and on his wife. And we're grateful to all of the donors who've spent time and energy helping us envision this amazing building. And of course, I have to say I'm thrilled and excited that so many of our regents are here from the Board of Regents, Iowa Board of Regents. They traveled far, especially some of them traveled long distances to be with us to celebrate. They have poured over spreadsheets and numbers and data and helped us build this facility and keeping a keen eye on affordability and what the goal of this enterprise is. And I have to say, they've done a great job and now they get to celebrate. And we brought this building in on time and under budget. I'll say that again, on time and under budget. That doesn't happen very often, especially these days, and I want to thank the board for helping us get there. Of course, I want to thank all of the UIHC leadership and staff. I mean, this is everyone's going to want to work out here, you all, so I don't know how you're going to manage that problem, but that's your problem, not my problem. But this is a great facility, and the leadership team who's been involved in this, from Denise and Brad to all of our other folks, Larry, I mean, this has been a heartfelt project and really an amazing opportunity. We have created a state-of-the-art facility here, and it's not just about patient care, it's about research, it's about training the next generation of healthcare workers, and it's attracting people to the state. I already heard from one of our leaders in the community who said this place has brought her brother back to Iowa to practice here. So that's what we're interested in doing, not only taking care of patients, but attracting talent back here to make sure that we can manage the healthcare needs of the entire state. So I'm really excited to be here, and I'm really excited to see all of you, and thanks for wearing your black and gold, those of you who did. I'm really appreciative. Now it's my pleasure to introduce my boss, Sherry Bates, the president of the Iowa State Board of Regents. You can kind of get what's happening here.
So yes, I did wear my black and gold today, but I did it because this is the exact same thing that I wore when we broke ground. So it was nostalgic. Anyway, thank you, President Wilson. It is a great honor to join you on this important day for the state of Iowa. I am proud to represent the Board of Regents as we dedicate this spectacular facility. I have also been proud to see the talent, vision, and dedication that have gone into planning and building this tremendous new healthcare campus. And I thank everyone who has been a part of such a monumental undertaking. This is not only a great day for the University of Iowa and the Regent universities, but for the entire state. Here at the UI Healthcare North Liberty campus, all aspects of the Regent's core mission will be realized. As we train the next generation of healthcare professionals, we will provide learning that empowers excellence. As we make new discoveries in this new state-of-the-art facility, we will conduct research that increases innovation. But perhaps the most significant impact this campus will make is in providing service that fulfills our public purpose and that meets our civic responsibility to enhance the quality of life. In that spirit, the UI Healthcare North Liberty campus will be a tremendous resource for patients from across the state and beyond, offering increased access to specialized healthcare and emergency medicine. Through this new medical facility, we want to ensure the best for Iowa's citizens, to promote the most sophisticated and most compassionate healthcare so that lives can be filled with as much health and happiness as possible. So, on behalf of the Board of Regents, thank you again to have all made this day possible.
Thank you to each of our leaders for being with us today and helping commemorate this wonderful moment. Please note that tomorrow there is a public open house from 10 a.m. to 4 p.m. The grounds will be open for hospital tours, a meet and greet with Iowa Hawkeye student athletes, sports challenges, demonstrations, hands-on STEM activities for the kids, and more. So please come back and bring your families. As we conclude the program, we will commemorate this as we always do with a ceremonial cutting of the ribbon. So at this time, I would like to have folks come forward for that, and thank all of you for being with us today. Go Hawks.
Yeah.
are around the corner this way, to the east. Enjoy.